Welcome to the stream. I'm Josh Rushing, sitting in for Femi Oke. The World Health Organization is leading a public awareness campaign aimed at tackling high rates of death by suicide across Africa. And it's urging governments across the continent to do more for people in crisis. So today we ask, why is there a mental health emergency in Africa? Hey, look, if you're watching this on YouTube, see that little box like right there? We have a live stream producer waiting to get your questions and comments to me so I can get them to our experts here in the show. So let's do this together. And it's a really important show today. I can use your help, but I want to warn you, we're going to be talking about some sensitive issues that include mental health and death by suicide. Joining us to discuss the mental health crisis across Africa, Aviwe Funani is a senior officer at United for Global Mental Health. She's in Cape Town, South Africa. Liz Kakoza is founder at Mind Lab Africa, a mental health care nonprofit. She joins us from Kampala, Uganda. And from Jos, Nigeria, we have Ruth Tilly Gatto. She is a journalist and a mental health advocate. All right, Aviwe, I'd like to begin with you. And so you're sitting in South Africa. And 6 of the 10 countries in the world that have the highest suicide rates are in sub-Saharan Africa. But 3 of those countries are actually within the borders of South Africa. So I want to ask you, what's going on there? What's happening with mental health in South Africa?
So as you said, we definitely have a mental health crisis in South Africa. The biggest challenge is that we have a challenge of avoidance. We don't have the right policies, and there's still quite a lot of stigma when it comes to mental health challenges and mental health as a whole. We have 23 suicide deaths in South Africa every day, and then 460 attempts of suicide deaths in South Africa every single day. So at the moment, it really is a crisis that we're in, and we don't have enough services as a country. There's a 93% treatment gap. So it means that the number of people that need access to care and the people that receive care are not enough. We don't have enough services. Our mental health policy lapsed in 2020, and it has not yet been updated. Many of the mental health service workers are not trained enough to serve the people that are in their communities. And so that really leaves us in a space where we are constantly being reactive to the mental health crisis and not necessarily being preventative towards positive mental health.
Well, the UN is trying to do this campaign. And I want to bring in Dr. Joseph Kabore. He's the Director for Program Management at the WHO. Here's what he has to say about this.
Millions of people needing care do not have access to services, with untreated conditions leading to staggering devastation such as disability, substance abuse, and even suicide. Indeed, in the African region has the highest rate of suicide globally. Around 11 out of 100,000 people die by suicide every year. And this is above the global average of 9 per 100,000 people.
So Liz, he's talking about the suicide rates there. And to me, suicides in this issue are the canary in the coal mine. But they're also kind of the tip of the iceberg of a mental health crisis. And I don't know if we need to focus as much necessarily on suicide as why those numbers are so high. And that's kind of the broader mental health crisis. Now, you're in Uganda. You're joining us in the middle of a power outage. Is that right? In Uganda, you got about a 1 in a million chance.
In the suburb,
of Kampala, yeah? So I think we have a delay, and that's okay. I'll be patient when I ask my question. But in Uganda, you have a 1 in a million chance of meeting a psychiatrist, meaning for every million people that live there, you have 1 psychiatrist. But as you're in a power outage right now, how does the country, I guess, triage what they need to address here? Do they address getting you more steady electricity, or do they address getting more psychiatrists?
Thank you for your question. It's a very tricky question, but the obvious answer, of course, would be to get more electricity, right? We've not gotten to a point where we take mental health very, very seriously. Like you said, for a population of 45, 46 million, there's only one psychiatrist, yes. And it's very disheartening. We can blame all of our Africa's mental health challenges. We can say, oh, there's a lack of awareness. However, there are people on ground doing that work, right? That's what we do. That's what Aviwe does, right? But we have a policy gap. We have an access gap, right? So it's not just enough to say there's no awareness or to blame it on stigma. But we need to ask ourselves that pertinent question: what are we doing to address it? What action are we taking to address the mental health crisis? And I'll tell you for free, we aren't doing enough.
Okay, Josh,
right.
Josh, if I may.
Yeah, Ruth, I'm coming to you, and you're in Nigeria. I actually want to set you up, Ruth, with a bit of a package from an Al Jazeera reporter, Mohammed Idris. He did this. He was showing kind of children who have been in Boko Haram camps, and they're receiving this kind of psychological support after the camps. Here, let's run this clip.
Born and raised in Boko Haram camps, these children are experiencing for the first time what it means to be a child. They're part of the 6,000 victims and family members of Boko Haram fighters who've surrendered to Nigerian security forces in the past few months. After a few weeks of psychological support, those helping them are surprised by the rapid transformation they see.
You see a lot of them coming into the safe space looking very distressed, looking angry. But after weeks of engagement, or because we engage them for 3 months, sometimes depending on how we see their vulnerability and all of that. So after the engagement, you see a lot of changes. You see them interacting better. You see them taking leadership roles. You see them doing so much better.
So Ruth, watching this clip, it seems kind of promising, actually. It seems there are a lot of children who are getting the psychological support that they might need. Is that common in Nigeria? Is that the situation there where you are?
Okay, thank you very much, Josh. Thank you for having me on the show. So, like Liz said, for us in Nigeria, the challenge is not necessarily that we don't have the doctors or there is a lack of awareness. The challenge mostly is the fact that we have a silent culture, a culture where some things are just a taboo you can't talk about. And so watching that video, it is really hopeful. I'm excited to see, because Nigerians know that, these young people need these interventions. Even people who are just kidnapped by Boko Haramists or bandits need these interventions, because when they come back into the society, I tell you, they are not the same people. They are not the same people at all who come back into society, and it's difficult for them to acclimatize. So they also need this psychological help, intervention in such a way that, they can come back and be normal people. Because what they see in those bushes is not what normal people should go through. And so, yes, there is a lot of intervention now. There is a lot of awareness. The challenge is the idea of the silent culture where, we don't want to talk about mental issues. Nobody wants to identify as having mental issues. And
Ruth,
it is an
I think
issue.
you're hitting a chord for Liz here, because in Uganda, the word suicide, or I guess the word suicide itself is taboo, yeah? And the act of it's actually criminalized? I don't even understand how that plays out.
Yeah.
Can you touch on that?
Yes. So, yes, suicide is criminalized. It's an offense, and it's never made sense to me, because what do you do once someone dies from suicide? Do you try them? What do you charge them with? It's never made sense to me. And this was actually one of the issues that were highlighted during World Suicide Prevention Day last month. So yes, there's still a lot of stigma around the word suicide. It's not easy to speak about in public. I mean, as a suicide survivor, it's a part of my story that I often omit when I am doing my work around awareness and advocacy work around mental health. So we are also living in sort of a silent culture. It's very taboo. Even from a cultural perspective, if someone died from suicide, they don't receive a proper burial. Over the past year, I know people close to me that have died from suicide, or loved ones of people close to me, and that has been that has been the situation. Wow. Right? So we have a very long way to go in terms of getting people to of addressing, of understanding this, of addressing the stigma around suicide, and just I keep saying it is our inability to just talk about suicide that in the long run causes more suicides, right?
Hey Liz, can I give you a ray of hope here? Our YouTube audience, and let me tell you something, if you don't know much about the world of YouTube comments, it's not a place where there's a lot of gratitude and positivity, but we actually are getting a lot of gratitude for talking about this today. So maybe people are tired of it being taboo. And Aviwe, let me throw a couple of comments we're actually getting on Twitter and from YouTube here. This is from someone named The Real Shivanas Trivedi. They say the stigma surrounding mental illness in Africa is so bad it's now become denial. It's easy to jump to conclusions such as witchcraft. People replace prescription with prayer. When things turn to worse, they say God's will. He goes on to say, a priest, a pastor, a sheikh, a clan elder is more trusted than a medical doctor or a psychiatrist. A patient refusing prescription from a doctor in favor of rituals pisses me off because it's suicide. Faith is business in which integrity is obsolete. Sad individuals are unaware. Wow, he had a lot to say, but Abiway, can you pick up on that?
Oh yeah, definitely. It's something that I think in every African culture, regardless of where you are, it's the same thing. Culture and religion are embedded in African, just the everyday life of Africans. And with mental health, I think what exasperates the crisis, apart from the silent culture, is that immediately when people are showing signs of going into a depressive episode, or if they communicate even feeling suicidal, immediately they're relegated to the background. They're told that they need to toughen up. Culturally, they're told, I know in South Africa, it's usually associated with an ancestral calling. So what people call ugutwasa, and you're meant to go and go into initiation for being a traditional healer, or if you need to go for a prayer. So all these different elements of what it is in terms of African culture to be viewed as experiencing a mental illness. But again, there's also an opportunity. I think with all of that, there's always an opportunity. So now it's coming back to how do we actually look at the different systems and societies we're functioning in and actually develop programs that work. So integrating more community-based services is something that I advocate for a lot in African societies, because sitting across a psychiatrist or a psychologist, immediately the walls are up. There's a level of guardedness. There's a level of holding back. And already there's just so much taboo sitting within a person. And I think if we bring in elements of community, because community is something that is so important to Africans, that in actually when we integrate mental health services, it's important for us to also remember what is culturally appropriate, what can work for peoples that are operating in these societies, and we can just add on the element of mental well-being.
We have Josh, if I may.
Yeah, Ruth, jump in.
Okay, so if I may, my great aunt actually committed suicide. So I'm married now, but if my husband's family knew that someone in my lineage had committed suicide, they would not touch me with a long spoon. And that is amazing, because I just got to know this like 3 years ago. I was talking to my mom, and I don't know if she intended to tell me, and she just put it out there. And I'm like, what? Wait, what did you say? And she goes on and tells me the story. But then now I'm happy that several years down the line we can sit down and talk about this, so that people know that even if someone in your family has committed suicide, or someone a loved one has committed suicide, the stigmatization has to stop. Because if we don't stop the stigmatization, then people will not be willing to come out and talk about their mental health situation. Like you said, Joshua, earlier, there is a lot that leads to suicide. Even as little as trauma could build up and go into depression. But here, even as little as trauma, we don't pay attention to it. Someone says, I am traumatized, and everyone laughs, and it's like, really? Traumatized because of what?
Yeah.
So these are some discussions that we need to, talk about more openly so that people know that they need to get help when they are feeling mentally pressed.
Ruth, I wonder if we didn't do you a bit of a disservice by showing that clip from Boko Haram with the children, because they represent a very extreme example. I think most people would agree might need some psychological help, but really the problem's much more broad, it's much more ubiquitous, and it's much more common than someone who's been something as extreme as growing up in a Boko Haram camp, right? I mean, it's like we all deal with it, right?
Yes, we do, absolutely. And I would say that in Nigeria, for a lot of us, we don't necessarily have to be in the Boko Haram camp to feel the pressure. Because with everything going around, we feel like so many things are not working. So we almost feel like everyone is sort of like in their, Boko Haram camp sort of way, because we are so mentally pressured. You're trying to get just the littlest thing to work, like just good health service care. You can't afford that. Food, some people can afford food. So that puts a lot of pressure on people. So these are the things that, accumulate into all of, suicide and, the bigger things that we're talking about now. But in Nigeria, there is a lot of mental pressure. And like world over, it affects the men more than the women, because most men don't like to talk about their mental issues.
You know what, Ruth?
The rate, right?
I'm glad that you said that, because we actually have, we can come back, because I know you had more to say there, but we have a video comment from someone in the stream community. They sent this in to us. Their name is Eddie Kimani. They're about as far away in the continent as they get from you. They're in Kenya on the other side, and he is a mental health awareness advocate. Here, check this out.
To achieve the best possible mental health, I wish to share my path, my journey. I've learned that you cannot ignore your emotions over my nearly 40 years plus on this earth. As for Africa and mental health, I believe that governments and institutions and workspaces should fund more mental health programs. The solution lies in integrating mental health within the overall healthcare system and workspaces. And as Africans, as individuals, I would like us to see mental health move from just being a conversation to action, where we can start doing things and embracing our wellness and fighting the stigma that surrounds mental health.
So Ruth, there's a man talking about the stigma and talking about his own mental health journey. What do you think about that?
And an African man at that. So that is very impressive. Very, very impressive. And I call on all men, especially those in Nigeria, when you have issues, you know what happens back home? When most men have mental health issues, they resort to drinking. They become alcoholics. That's the way they take out their mental health issues. They just drink to stupor and come back home and sleep, or come back home and, get involved in all the vices of, domestic violence and things like that. That is what they do. So if an African man can talk about it, I think that now is the time for all men to come out and say, look, I am depressed. I have had issues maybe in my office. I've had pressure here and there. I am actually depressed and I need help. Now is the time to talk about it, because it is only a healthy person that can be healthy for society.
Eddie Kimani, they're singing your praises here on the stream. Listen.
Can
Hey,
I add
Liz.
on that, Josh?
Yeah. Go for it, Abiway. Go for it.
So with just going back to the Boko Haram camp and what Ruth had mentioned. So there's something called toxic stress. If you're constantly exposed to stressful situation, adverse experiences, that actually increases your threshold of experiencing what we call toxic stress. And that means that in the long term, that increases your risk of mental illness, increases the chances of suicidality, increases chances of anxiety, at-risk behavior. So with all of that, it means that the preventative mental health measures are very important. Yes, it's important for us to treat mental illness and also provide safe spaces for when people are suicidal. But I really believe from a young age that we need to put in preventative mental health measures. So in other words, we teach people how to find safe spaces and communicate their feelings, teach people how to be able to become self-resilient, how to calm themselves down. I know right now self-care is like the buzzword, but at the end of the day, that is a part of being mentally well. And the reality is we all have mental health. It's not just mental illness, but mental health as a whole is a spectrum. So every one of us sitting here have mental health, but how do we maintain positive mental health? How do we take care of our mental health? It's like brushing your teeth every day. Do something every day that contributes towards a positive mental well-being.
Liz, can you pick up on that?
So, yes, I'll just quickly go back to what Ruth shared about, addressing men's mental health. So what we've noticed, what we've observed over the years is generally in the healthcare system, women have better health-seeking behavior than men. So even if it were something like a cold or during COVID, a woman is more likely to seek out treatment, treatment of some kind, which isn't the same for men. However, in addressing mental health challenges amongst men, what we've discovered or what we've seen locally is it's important for us to consider reaching men where they are. Yes, they suffer more from, suffer more from depression. Suicide rates are higher among men. So they are the most vulnerable when it comes to these conversations. But how do we help them? How do we ensure that they have access?
Oh, Liz, you're breaking up. Ruth, I wanted to.
I know where to find them.
Oh, wait, there she is. Ruth, one of the things I read was that we look at the suicide numbers, but they represent a successful suicide attempt represents 1 in 20 of people who actually attempted it, meaning the problem is 20 times larger than what the actual numbers say. Can we use the last few minutes of the show here, if everyone has some tips on what you would advise people to do who might find themselves in a mental health crisis? Ruth, do you have some tips like that you could share?
Yes, I think the first one would be, and thank you, Josh, I think the first tip would be that be aware that there is a mental health. Be aware. You must be aware. We are very easy to seek help when we have like a headache, we have malaria back in West Africa, and people just go to the hospital. So when you feel that mental pressure, it could be as little as just feeling traumatized about something or just feeling depressed about some issues. Please go and seek help. Don't wait until it becomes big. So be aware, be very aware that there is something called mental health and it could affect your productivity.
All right, Liz.
If you don't do anything
so
about
Ruth says be aware and seek help. Liz, do you have some tips for people? And there are people in our YouTube chat right now talking about their challenges.
What I would say is it's okay not to be okay. And it's that acknowledgement first of all that eventually leads you to will lead you to seek the support that you need. So it's important to be mindful and say it's okay not to be okay. The same way I'll have a headache or a flu is the same way you need to address whatever mental health challenge you're going through at the time.
And Aviwe, what do you got for us?
Just to follow on the ladies, again, identifying your feelings is very important, but also reaching out to 24-hour suicide helplines. I know there are quite a few in Africa. Here in South Africa, we have the South African Depression and Anxiety Group. There's a 24-hour helpline in terms of suicide, and you can call them and speak to someone. It's an anonymous line. And then also reaching out to community groups that work with people that are needing mental health services. So really just taking those steps, even gentle steps of speaking to someone that you trust. And that is my main encouragement.
All right, so I think that's where we're going to end it today. I want to thank all three of my guests, Aviwe, Liz, and Ruth, for being willing to come on and talk about something that is taboo, but is even more important. And if you're out there and you need help, I promise there are people that want to help you. There are crisis lines that you can get to. So that's all we have time for today. But you can always find us online at stream.aljazeera.com. Take care of yourself, right? Thanks for watching.